Professor Brendan Crabb is the director of the Burnet Institute. He is the winner of the Australia's Hero Award. It comes from the international anti-poverty group Global Citizen. Brendan, thanks for joining us.
Thanks for having me, Raf.
What's Global Citizen? What's the Heroes Award?
Global Citizen is effectively an advocacy organisation, focuses on poverty and all the things that drive that. And, they're actually Australian-born, but now they're very much New York-based and international and have shifted the dial through their sort of populist approach to getting attention to something that is normally pretty under the radar. So fantastic honour for me, for my organisation, for all of those who work together for the cause, who are really the recipients of this award, because they're a very special group.
What do you mean by a populist approach? What do they do?
Well, they use celebrities and musicians and philanthropists and people of high public profile to promote the cause. And that might sound easy, but it's not easy. And it's through the incredible leadership of Hugh Evans and his team, Melbourne-based Hugh Evans, or Melbourne-originated Hugh Evans.
A Tree Foundation guy.
Yeah, and wow, they've just created this group that directly and indirectly has leveraged tens of millions, more than tens of millions of dollars for the cause over the years, and more importantly, got governments to focus and act on why poverty is important. Poverty is a moral issue, but also as the bedrock of society, of humans advancing, not just as some side thing we do to feel good, but if we want a more secure, if we want a more prosperous and healthy world, that's where you start. And Global Citizen really promote that like no other group.
And what did you do to deserve your award?
Nothing much, actually. But those who I work with have done a lot to, in the COVID year especially, to promote the idea that, when there are solutions to COVID, they've got to be available to everybody and got to be available affordably, preferably for nothing, to those at the bottom of the pile, and they've got to be available immediately. So that's the first thing we all pushed very hard for, and the Australian government has stepped up magnificently, both for this country and for the region, in various ways that it really has, that it's promoting COVID vaccine and its availability to everybody. So, that's the first thing. And the second thing really is the non-COVID effects of COVID. There's a lot of them. And in the region, especially in developing countries, we worry more about those than actually COVID itself, even though we worry about COVID. What's happened to malaria and HIV and TB and mums having safe pregnancies and safe childbirth and sexual and reproductive health? These are fragile health systems, and as soon as anything affects that, such as the pandemic is doing, the wheels can come off, and so we worry a lot about that. So it's advocacy in that space.
And you think the federal government's done well in places like PNG and the Pacific on these issues?
Oh, they've stepped up this year. I've been pretty critical over the last 4 or 5 years, of funding dropping away for foreign aid, but it's really hard to fault them this year. And look, they're the commitments. We've got to make this work well over the next 6 to 12 months and hopefully make these increases in funding for our region sustainable. Because the real message is that, COVID especially isn't over for Australia, even though we're at COVID zero, but it's really not over for Australia. We're not back to normal until it's over for everybody. That's the first thing. And the second thing is a secure and prosperous region means a secure and prosperous Australia. And they're totally linked, and I sense that our government palpably gets that now.
How do we end up doing so well with COVID in Australia, do you think?
Well, I think one of the key lessons of COVID is that it's binary. You either have zero or you have a lot. We didn't know that early on. Early on, there was every chance that you could let it trickle along, that you could keep it just under a certain level. It turned out to be not the case. So countries like the UK, France, Spain, the US, that are 20 to 50 times worse than Australia in outcome, they are not 20 to 50 times worse in response. But that's the binary nature of this thing. We decided to crush it nationally and at state level. That turned out to be an incredibly wise decision. If you choose to just keep it low, you're in trouble and you'll pay a big price, and that's what we're seeing all over the world now.
Can you compare us to the rest of the world? I mean, the boast is, and I don't know if it's a boast or not, we got rid of it twice in Victoria. I don't know how significant the first wave was, but the second one was. Not many places have gotten rid of it twice. Is it fair to compare us to other countries, or is every country and every population different?
Oh, no, there are comparisons that are real. What the attitude that we took is what you can compare us to, is how you can compare. Attitude is everything. Attitude is what's made the difference to the 6 to 8 countries in the region that have done really well. It's not just Australia and New Zealand, but Taiwan and South Korea and so on. They've done really well, and the difference between them and other countries around the world is attitude. That attitude that zero COVID is the only way to live with COVID. That's what's made all the difference. I think we can be very proud of that. Of course, mainland Europe has its own issues. Places in the US have their own issues. But you can line up that attitude of ours versus others, both of governments and of the population. You can be really proud that we did what we did.
Is there a special place in purgatory for those who lauded the Swedish model?
Oh, they certainly frustrated me. I wouldn't go as far as to say purgatory, but I think it was as plain as the nose on your face that they were, dicing with death. Quite literally, they had 5,000 or so deaths in the first wave, which by Australian standards, correct for population, would be about 12,000 deaths. How on earth anyone could think that was a sensible strategy? And now look where they are with this extremely concerning second wave as they enter winter. It was foolish all round, and I really worry for the people of Sweden in the coming months.
Why do so many parts of the world not think the virus is a problem? Do you think that's is that just social media spreads misinformation? Is it maybe humans have always not wanted to believe a virus or a plague is a thing? Why do you think so many people don't think the virus is a problem?
It's interesting you say misinformation. There's clearly been a lot of deliberate misinformation, and who knows the reasons for all of that. I think, though, that probably the primary reason is the misconception that there's a dichotomy between health and wealth. If you focus on coronavirus, your economy is going to perform poorly. Well, that just turned out to be utterly false. The better health you have, no matter how hard, lockdown or not lockdown, whatever methods were used to deal with coronavirus, has correlated quite well with keeping the economy intact. And so I think that notion is probably what drove a lot of look, we think COVID's important, but not that important, not as important as keeping our society going. That turned out to be a false narrative.
Professor Brendan Crabb from the Burnet Institute has won Australia's Hero Award from the international anti-poverty group Global Citizen. Brendan, what do you want an exemption from?
Oh, look, as you know, Raf, I was quite the elimination zealot, so I'm not sure I'm really deserving of an exemption.
Right.
But I did hear someone say from difficulties with your kids, and gee, I've got 3-year-old twins. I love them very much, but boy, I'd love an exemption from getting up in the night.
Thanks for your time.
You're welcome. Thank you.
Professor Brendan Crabb. Brendan Crabb is the director of the Burnet Institute. I'll say it again. Burnet, Weehai, Kirby, Doherty. It's the difference. It made the difference for Australia, our medical research institutes. They are tightly interwoven with our political class and our journalists. It's the reason we did well.